Hi everybody, this is Kaylee, and today we're going to continue our discussion on sexually transmitted disease by talking about genital herpes. So, first and foremost, what is genital herpes and how common is it really? Well, genital herpes is a viral sexually transmitted disease that takes two forms, type 1 HSV1 and type 2 HSV2. Now, the more common one is HSV2 in most genital herpes cases. Right now, in the United States, 45 million people have reported to the CDC that they have genital herpes. That means 1 out of every 5 adolescents and adults have the disease, which also means it's Russian roulette down at the frat house. Genital herpes type 2, HSV2, remember, is more common in women than it is in men. Typically, 1 out of every 4 women with herpes has type 2, as opposed to 1 out of every 8 men. Overall, however, over the past decade, numbers of genital herpes cases have been decreasing in the United States. So, if 75% of the adult population actually carries the herpes virus, well, how do you know? How do you have any idea if you're infected with genital herpes? The signs and symptoms may or may not occur. Most people with type 2 genital herpes have no idea that they're infected. However, if symptoms are going to occur, they'll usually show up about 2 weeks after the virus has been transmitted. And they'll show up as painful blisters around the genitals or rectum. Unfortunately, these blisters will burst, leaving tender ulcers that take anywhere from 2 weeks to a month to heal. The first appearance of these sores in people with genital herpes is generally referred to as the first outbreak. Now, when this happens, some other things can also occur, such as a secondary cluster of sores appearing immediately after the first has healed, and also flu-like symptoms, including fever and swollen glands. Now, unfortunately, most people with type 2 genital herpes have no idea because they never have sores that show up. And if they do, it's so mild, it's often mistaken for another skin condition such as a rash caused by your genes or sometimes even a bug bite. Now, typically, if this first episode or outbreak has occurred and been diagnosed properly, those with type 2 genital herpes can expect to have 4 to 5 more outbreaks over the course of the first year. Typically, these will decrease with time. However, if you have type 2 genital herpes and are unaware, years can go by without the occurrence of a first outbreak. So, if you have herpes, whether or not you're aware of the signs and symptoms, or if you show them, they can cause complications. Now, in adults who have suppressed immune systems to begin with, infection can be severe, causing painful genital sores in most adults and adolescents. We've already discussed this. However, for the most part, herpes causes more psychological distress than actual physiological distress in the infected. This has one exception though. With pregnant women who have been diagnosed with herpes, they can pass this on to their newborn children during vaginal birth, and this can lead to serious life-threatening infections in their babies. Now, for the most part, if herpes has been previously diagnosed, a cesarean section will be performed to deliver the baby so that these complications can be avoided. Now that we've talked about your risk of getting genital herpes and what can happen once becoming infected, let's find out. Is there any treatment for herpes? Well, yes, there is treatment for genital herpes. There are certain antiviral medications out there that can help prevent or shorten outbreaks in some cases. However, being a viral sexually transmitted disease, at this time there is currently no cure for genital herpes. So once you have it, you're stuck with it for life. What do the devil, adultery, and sexual experimentation have in common? Join us when we discuss the word origins of orgy, mistress, and sadism. Thanks for joining me on our continued discussion of sexually transmitted disease. And this is Kaylee signing off. Please leave me your comments, rate my video, and don't forget to subscribe. Bye now. Hi everybody, this is Kaylee, and today we're going to continue our discussion on STDs. No, we're not, because I can't talk. Well, genital herpes is a viral STD that takes two types, type 1, or that takes two forms. Damn it.